If you're someone who's looking for an exercise that's gonna help you stand up straighter, walk with better posture, walk with better balance, and get rid of low back pain, I got that exercise for you right now. What's up, YouTube MS Gym family? My name is Trevor Wicken, and I am the founder and creator of the MS Gym, the largest platform for movement, mindset, and education for people affected by MS and other neurologic conditions. So we release videos on this channel quite often. So make sure that you watch this video, you like this video, and then you go and subscribe to this channel so you don't miss out on all the awesome content that we're going to be putting out that's going to help you counteract your symptoms and live a life by design and not by diagnosis. With that, I encourage you to watch till the very end of this video because I always have some special offer for you that will give you an opportunity to come train with us inside the MS Gym. So oftentimes with people with neurologic conditions that have gait abnormalities, we get a walking posture a lot like this, okay? Your hips are pushed back. You're sometimes gonna get overarching in your low back. There's a lot of forward movement, a forward trunk flexion and a hip flexion. And so many people struggle to stand upright because they're just like, I just feel like I'm constantly being pulled downward. And a lot of times that is caused by weakness in the glute max, which are these muscles right here, and then the glute medius, which are these muscles right here. So in order for you to be able to stand upright, pull that walker closer to you and walk using this walker as a mobile balance station instead of a mobile crutch, it's going to take a lot of work of working on your glutes and your outer glutes so that you can stand upright, turn those knees outward, and feel strong up on your feet. So a super effective exercise to work on that upright standing posture or that posterior chain activation is going to be banded hip bridges. So what you're going to do here is you're going to grab a band, like one of these loop bands. This one is cool because it has a clip. So I'm just going to put that around my legs. Click, okay? So it's here. Then you're going to lie on your back if you're able. This is something that you can do on a therapy table, on a mattress, whatever it might be, okay? Now, what you're going to do is you are going to push out on that band as you're doing this, okay? So the entire set, you're going to be pushing out on that band to activate your glute medius. So as you're pushing out on that band, what you're going to do here is you're going to tip that pelvis back so you feel your low back touching the floor. Then you're going to use your glute max muscles, your gluteus maximus muscles, to lift your hips off the floor, and you're going to hold them when your muscles are in full contraction, and you're going to avoid arching your low back because that's only going to add to the problem when you're standing. So we're going to be pushing out on the band. We're going to tip our pelvis back so that we feel our low back pushing to the floor. We're going to hold that little bitty pelvic tilt. Then we're going to slowly lift our hips off the floor. I want you to squeeze your glutes, so push out in the band, squeeze your glutes, squeeze your booty cheeks together like you're trying to hold a pencil between your booty cheeks. We're going to hold this for 10 seconds, okay? We got about 5 seconds left. 4, 3, 2, 1, and then we're going to return back slow, coming down, letting our low back contact the ground, okay? We're going to continue to push out on those bands the entire set, then come up again, so it's a 1, 2, 3, hold, 2, 3, 4, 5, 6, 7, 8, 9, 10. Coming down slow, letting that low back touch the mat, okay? Pause, and one more. So come up, 1, 2, 3, hold, 2, 3, 4, push out on that band, 5, pull it down on the abs, 6, 7, 8, 9, 10, come back down, okay? One more. Now, when we get up to the top, so go ahead and rise up. So 1, 2, 3, I want you to do what's called a butt-gut sandwich. So we're going to push out on the bands, we're going to squeeze your booty, and then we're going to pull those abs down to create a nice activation of your core, of your abs, of your spine, of your legs. You're really going to feel that in those glutes. I can feel them crushing right now. You got 3, 2, 1, and coming back down nice and slow, okay? And relax. So the key is on this hip bridge is that you want to lift from your glutes not arch up with your low back, because that can cause low back pain, and it can also add to those standing problems up on your feet, okay? So this banded exercise is really, really good to hit up that isometric contraction in your glutes and your hips, because isometrics, so keeping that contraction in that muscle over 5 to 10 seconds, is really going to help your brain connect with your hips connect with your brain, and your spine, and your deep core, and your postural stabilizers, so that when you're standing up on your feet, your brain feels more stable and more confident using your hips and not tipping forward, causing you to feel like you're going to fall.